Hey everybody, I am I'm doing this video real quick. I always say that. It's probably not going to be real quick, but sorry for the creepy ambiance. I'm in the car waiting for a pizza before our Christmas parade, and I have been looking for an opportunity to do sort of a public service announcement as far as dizziness and meds are concerned, because I've had just several clients recently that this information could have helped a lot more before I got a chance to get to them. So if you are prescribed meds for dizziness in the ER, for instance, if you go in with a vertigo episode and you end up in the ER because of vomiting, you had a fall, they will most likely discharge you on meclizine, and that is fine to continue to take while you're having active vertigo to make sure that it keeps it at bay and you don't fall again. They'll probably give you something for nausea as well. That is fine to continue to take. Once you are over that acute spinning episode of vertigo, you need to try, if you haven't gotten into a vestibular therapist that had told you this or will tell you this, get ahead of the game. Start to see how long you can go between doses without getting spinning. Even if you get a little nausea, there are things, cold pack to the back of the neck. The point being is the longer you stay on meds like meclizine, there's a whole list of benzodiazepines like Xanax, Valium, Ativan. They're all benzos. That category is a vestibular suppressant. They give it to you for good reason, just like opioid is prescribed after a surgery for pain. It takes care of that pain very well. When you use it, when that acute pain is no longer there, that's when you are at risk of getting addicted. So in this case, I'm not really talking about the concern of addiction. It's that you cannot retrain your vestibular system while you are still on vestibular system suppressants, things that prevent your vestibular system from getting back up to par and doing its job. It will continue to make you feel hazy and out of it, a little off. It can actually kind of make you feel dizzy. So sometimes by the time my patients get to me, they no longer are having acute vertigo. Their acute situation has resolved. My only job is to show them that as they wean off their meds, they're okay. And now I can retrain their vestibular system and they can get on with their lives. But you can get a step ahead of the game if you are on these meds, and you can start to, because the only thing that doctors tell you is stay on them as needed for dizziness. And people get so anxious about having another episode, they start to determine as needed means every 6 hours, because I don't want to get dizzy. I'm afraid that I might get sick. So just take my word for it. You cannot get fully better if you are continuing to stay on these meds. The second part of this is there is a group of meds that is very effectively used in the treatment of vestibular disorders for chronic dizziness in like 3PD that I have not yet to do a video on, but I will. 3PD, positional, perceptual, postural dizziness. Any type of chronic dizziness. You no longer have the acute episodes of vertigo, the acute thing like an infection that was making you dizzy. Chronic dizziness can be treated effectively with vestibular rehabilitation, but some people also need something like antidepressant / anti-anxiety along with vestibular rehab. Those group of meds are SSRIs, are the most common ones, like Celexa, Lexapro, Prozac, Paxil, Zoloft, all those major antidepressants that so many of us are on. SNRIs are the other group. Cymbalta, these aren't, I'm not as familiar with. Effexor, Ultram. Those two groups of meds have been shown to be effective in helping treat dizziness in the long term in people who have it chronically, along with vestibular rehab. Those meds in the oven themselves are not going to get rid of your dizziness. You have to see a vestibular therapist as well. You have to go through vestibular retraining, but those meds can help you get over that hump of being so anxious or nervous that you're going to get dizzy or going to have another episode, that you're not leaving your house or you're not driving. All those things that are associated with some depression, some anxiety, those meds have been shown in research to be very effective. Not benzos, not Valium, not Ativan, not Xanax. You need to get off of those. And if you still need something, it's these other group of meds that you need to talk to your doctor about. SSRIs, SNRIs. Those are serotonin specific reuptake inhibitors. I had to write it down to make sure I got it right. And serotonin norepinephrine reuptake inhibitors. Two groups of meds. Ask your doctor about them. Do not stay on benzos. They will keep you from getting better. Trust me on this. Okay, that's it. Bye.